It is clearly developing from a mutation of a virus that lived in the bat, but it seems like it's the horseshoe bat, which is not necessarily the type that was sold at the wet market. So there are a lot of questions we don't have the answers to right now. I certainly know from my experience with China that there is no way that the government deliberately released this. That I'm sure of. I've been working in China long enough to have confidence in the ability of my colleagues. However, I also know that laboratories are very difficult things to manage, as I used to manage some of them myself in my research. I think we need an international expert committee to come in at the invitation of the government of China and the government of the United States and the European Union and all of the relevant groups, of course the World Health Organization, but it's got to be invited and given full access to the information, because there's just so many ideas running around now, and them's pretty bizarre, and we won't know what's really true until we have a more full investigation of this. We will continue to rely on experts, but they won't be at the White House. They'll be back at the National Institutes of Health where they came from, right? That's okay, but it's still, this is a big problem. It's not going to go away. And whether you have a White House task force or not is frankly irrelevant. If you ask, what did the White House task force do? It did not provide a national leadership policy overall. There was no attempt for the government of the United States to actually work as a single government to help all the states. In fact, it was like the Wild West to all the states. You're on your own. And then when Governor Hogan of Maryland negotiated with the government of Korea to bring in tests and masks, and Governor Hogan, by the way, is a Republican like President Trump, people in the White House said, "Why did you do that?" I said, "Well, what do you expect me to do?" He said, "You've said we have to get our own, so we're taking care of ourselves." I think that that's not good federal policy. I think that there should be a national government that should be coordinating what's going on, and maybe that's where we're headed. I don't know what he had in mind, and very few people do.